This is One-on-One. There she is, Katherine Grant Davis, President and Chief Executive Officer of the New Jersey Primary Care Association. Good to see you, Kathy.
Thank you. Glad to be here.
You have been with us many times talking about a whole range of healthcare issues. By the way, let everyone know what the Primary Care Association is.
Primary Care Association is the trade association for the federally qualified health centers, otherwise known as FQHCs.
Now, the FQHCs, federally qualified health centers, where are you?
We're
Who do you
all
serve?
over, 113 sites. We're in 20 counties. We serve anyone who walks in our door by federal law. Most of our patients are indigent or without insurance.
You know, as we put up the website for people to get more information, I always hear people say, oh, Steve, I saw that show you did. That's about a clinic, right? But it's not a clinic.
We don't use the word clinic anymore. When I came into this job 20 years ago, we had the clinic model, but we're now medical homes. We've expanded our hours. You come in, you see the same doctor, you get the same team of people, and many of our centers are now patient-centered medical homes as accredited by either JACO or the National...
JACO is?
The Joint Commission of Ambulatory Health, forget what the O is.
They always
but
have all kinds of acronyms.
I know.
They're the regulatory body that comes in and says you're good.
Exactly, and says you're good. And then
Right.
there's another one, which is NCQA, which focuses only on quality. So we're getting those standards as well.
As we approach the fall of 2013 doing this program, a lot of things are changing.
Yes.
Right? This program will air before or after. But here's the thing. You have told our producers, and you've said this many times publicly, that you believe that healthcare reform that's about to officially happen in January of 2014, but is really happening as we speak.
Yes.
You believe it's a really good thing for the people you serve. But here's my question. What's supposed to happen? Is somebody from the federal government supposed to knock on someone's door and say, here's this card, you now have insurance, health insurance that you didn't have before?
Yes.
That's not going to happen. So why is it good?
It's good because it'll give people a better range of services. Right now, we do a lot of primary care. If you have coverage, you have access to specialty care. You then have access to hospitalization. It'll cut down on charity care as well. Now, part of the issue...
Charity care is you go to the emergency room.
That's right.
You must get treated by
That's
law.
right. That's
and
right.
then that bill
is
gets
astronomical, but if we do a better job because people have coverage, coverage means you come in with a card and somebody is responsible other than the patient for paying. Primary care is really the key to healthcare reform because it's the front end. Similar to me, I'm diabetic. Someone needs to manage my care. If my care is managed, I don't end up getting sicker. So it is a good thing, but there are some things that are happening that aren't so good.
Go ahead.
Number one is that I don't think we have enough physicians.
So let's play this out. You keep saying that the key is primary care.
Yes,
If you get really good primary care, you'll have fewer trips to the emergency
that's
room.
right.
Fewer trips to the emergency room, that's a good sign. That means
Yes.
people are healthier. But
Yes.
we don't have nearly enough primary care physicians.
That's
Therefore,
absolutely
what
right.
is the answer?
We have been recruiting. We're working with the Council of Teaching Hospitals. We're working with the Department of Health. We're using more nurse practitioners. So we're trying to expand that model. And the other thing that we've done, I think we've done it well, is that we're looking at different ways of doing our model. As an example, everybody doesn't have to have an appointment. We now have what's called open access. You come in, we see you as quickly as we can, and we're not stacking up the waiting room. We actually have some physicians that we don't even give appointments to. They are there only for walk-ins.
Describe what happens. Someone comes in to one of these community health centers.
Yes,
One of yours.
yes.
They don't have to have an appointment?
In some cases, no. In some cases, yes. Like
How would they know the difference?
the type of patient that you are. So when you first come in or you call, if you're an OB patient, we typically like to get them on a regular schedule, better outcomes. But if you call and say, I have an earache today or a sore throat, I'm not sure what's going on, we try and get them in without an appointment. So it depends on the service. Some services you really do need to have scheduled appointments versus just walk-ins. So we play both
So
models.
they walk in, what happens?
We walk in, we do the intake, we do the financial screening, and they will go to see their team of providers. And a team of providers for us is a medical assistant, a nurse, and a physician.
So the whole team.
We work on team concepts, interdisciplinary care.
But here's what I keep thinking. Ken. We've done so many programs on our sister program, Caucus New Jersey with you, and Capital Report, our other program, public policy programs.
Yes.
But one-on-one is more about the human side of things, less about policy and politics. On the human side, I always worry and wonder about how people are supposed to get the information. Like there's something called the healthcare exchange that the federal government is responsible for. The Christie administration opted in New Jersey not to be responsible for this. The federal government is now handling it. Each state has their own choice as to how to handle this. Here's my point. Where the average person watching this program, say you're watching us in any state, New York, New Jersey, Connecticut, Pennsylvania, wherever, how would someone know how to go on this so-called health exchange, which is on the internet, and pick, as if they were going on vacation or picking a hotel, which kind of health insurance they would want? Because now, based on the new Affordable Care Act, they are now eligible for health insurance based on so-called Obamacare. How would they do that?
I'm glad you asked that question.
Because that's the question I don't have an answer to.
I have an answer for you. There are what are being called navigators.
Navigators.
Navigators, which is part of the federal law. We will have navigators. We collectively, the health centers, have hired 69 of these people. Their job, get out in the community, walk people through what they need to do, help them go on the website. Not only do we have navigators, the hospitals are going to be doing outreach and enrollment. Private groups like Citizen Action, other groups like Enroll America, Outreach America, churches. So there's information. Our people will be trained by the federal government.
So hold on. You're in New York City.
Yes.
You're in Newark, you're in Atlantic City, you're in Philadelphia, you're in Baltimore, you're in a lot of different places, cities, say along the Eastern Seaboard. How does one, living in those communities, disproportionately where people are, it doesn't mean if you're in a rural area that you may not have been eligible, and now you are because of so-called Obamacare. But say you're just in these urban areas, how would you know where these people are?
We know where they are. We've been working with this population for 20 years.
No, but how would these people know who these navigators are?
The navigators are required to be out there going to churches, supermarkets, beauty parlors. They are required to be out in the community providing this information.
In the streets?
Yes.
Grassroots?
Absolutely.
Person to person?
Absolutely. The way we used to do it when I was growing up. I won't say how long ago that was.
But really, really in the streets?
Yes, in the streets, grassroots, with materials in various languages as well, saying to people, you are eligible, let me walk you through this process.
Before I let you out of here, National Healthcare Week, even though this will air later, National Healthcare Center Week is?
August 12th through the 17th. We have 72 events going on around the state of New Jersey.
And by the way, even if this is seen after, just remember National Healthcare Week should be every week.
I agree.
Kathy Grant Davis, President and Chief Executive Officer of the Primary Care Association here in New Jersey, but there's one in every state. Great stuff.
Thank you.
Keep it up.
Thank you.
This discussion will never end. By the way, you're a diabetic, but you lost 28 pounds, and you have gone from however many medications you were taking now to
really 1.5, and I'm getting rid of that half. So soon I'll be down to just 1.
Look at you, taking care of your own self.
Yes, I am.
Thank you,
I feel
Kathy.
great. Thank you so much.
And you look great. Appreciate it.
Thank you. Thank you.
Talk to you soon.
Okay.
Hey, stay with us. We'll be right back right after this. 28 pounds.
Yes, yes.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One has been provided by Meridian Health, Johnson & Johnson, New Jersey Manufacturers Insurance Group, the law firm of Gibbons P.C., Cohn Resnick, and by New Jersey Natural Gas. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.